Good afternoon. Welcome to the National Press Theatre. My name is Bruce Campion-Smith. I'll be moderating the session today. We're joined by Deputy Prime Minister Chrystia Freeland, Health Minister Patty Hajdu, Treasury Board President Jean-Yves Duclos, Public Safety Minister Bill Blair, Transport Minister Marc Garneau. Each of them has a statement. We'll take 5 questions from the floor, and then we'll go to the teleconference after that.
Okay.
Minister.
Merci beaucoup.
Thank you very much, and good afternoon to everyone. Today, I am accompanied by the Ministers of Health, Public Security, Transport, and by the President of Treasury Board and the Vice Chair of the Cabinet Committee on COVID-19. Doctors Tam and Yu will address you after this press conference. We have decided that because of the advice to keep social distance, we would only have 6 people at a time here up on the stage. We are living in critical times, and our efforts aim to contain the COVID-19 spread and to reduce the burden on our healthcare system and on our outstanding professionals. Our priority is the health and security of Canadians.
We are taking a whole of government approach and indeed a whole of Canada approach to limiting the spread of COVID-19 and to keeping Canadians safe. The measures which the Prime Minister announced just now are essential to that effort, and we will continue to adapt our approach to the ever-changing environment in which we all now exist. As Dr. Tam said yesterday, Canada's window to flatten the curve is closing. I urge Canadians to listen to the valuable advice from our public health professionals and public health officials. These are and must be our entire country's trusted sources of advice and information. And what the experts are telling us is that this situation will get worse before it gets better. This is not a time to quibble about federal and provincial responsibilities or about who will pay the bill. Our clear priority is and must be the health and safety of Canadians. And I have to say, I am so proud of how Canadians, from business to labor, from Indigenous leaders to premiers and mayors, and of course our outstanding healthcare professionals, are all rising to the challenge. Team Canada truly is coming together. Together we can meet this challenge, and we will. We must all act now, and we must act together. Starting today, we will be formalizing formal federal government updates as daily briefings for Canadians. We will also provide a daily briefing for all parliamentarians. So now we're going to hear from the Minister of Health, Patty Hajdu, then the Minister of Transport, Marc Garneau, then the Minister of Public Safety and Emergency Preparedness, Bill Blair, et mon cher collègue, le président du
And my dear colleague, the President of Treasury Board and the Vice Chair of the Cabinet Committee on COVID-19, Jean-Yves Duclos. Thank you.
Well, thanks everybody for joining us, and good afternoon. As Canadians know, the cases of COVID-19 are rising in Canada, and all levels of government have been working together to prepare and support Canadians through this unprecedented health crisis. First, I want to offer my deepest thank you to those on the front line, the public health officials, the border service agents, the healthcare workers, and the many others who are working so hard on behalf of all of us. And I also want to thank all of the other workers who are often unseen and unsung, the cooks, the cleaners, the drivers, and others who are keeping all of the things that we need running. As you've heard Dr. Tam say, now is the time to pull out all of the stops to flatten the curve or slow the rate of infection.
We must try very hard together.
And it will require much personal sacrifice. And it will require all of us helping in many different ways. Ensemble, nous pouvons aider nos familles.
Together, we can help our families, colleagues, and communities.
The measures that we take together now will protect people in our communities who are most at risk and ensure that our healthcare system can meet any surge in demand. All of us can take actions to reduce the spread of COVID-19. Stay at home. Wash your hands well and often, and practice social distancing. I know that many people are worried about running out of food and other essential supplies. Please know that we are not running out of food or other supplies. The Retail Council of Canada is working very closely with our government to ensure that our supply chain remains strong. Please don't buy more than you need in a 2-week period. Remember your neighbors, those people that buy just in time, and buy only what you need. Be kind to one another. Even though this is going to be very hard, Canada is strong, Canadians are strong, and we've been through times that are hard before. The things that we do now that require sacrifice and generosity will get us through this time together.
OK, et maintenant le ministre Garneau.
And now Minister Garneau.
So let me get into some specifics about travel. Today, as Minister of Transport, I am enacting measures under the Aeronautics Act in order to reduce the spread of COVID-19, especially through international travel. As the Prime Minister stated, effective March 18th at noon, Canada will deny boarding to all foreign nationals on flights to Canada other than transborder flights, in other words, flights from the U.S., and to any foreign national who has resided outside of Canada or the United States in the last 14 days. The measure will not apply to Canadian citizens and permanent residents, immediate family members of citizens, or permanent residents, to air crews, to travelers in transit to another country, and to diplomats. Je vais répéter en français.
I will repeat in French. As of noon, March 18, Canada will prohibit boarding for any foreign national wanting to board a flight towards Canada from any country other than the U.S., as well as any foreign nationals who have resided elsewhere than in Canada or in the U.S. in the previous 14 days. This measure will not apply to Canadian citizens or to Canadian permanent residents or the immediate family of these two groups, to flight crews and staff, and travelers in transit towards another country, or to diplomats.
Introduce screening measures for passengers before they board flights destined for Canada. Air operators must do basic health assessment of all air travelers before boarding, following guidance from the Public Health Agency of Canada. Any passenger, regardless of citizenship, with possible COVID-19 symptoms will not be allowed to board flights to Canada.
Air operators will also have to assess passengers before they board onto an aircraft bound for Canada, and any person showing symptoms of COVID-19, regardless of their nationality, will not be authorized to board the aircraft.
If a passenger begins to show symptoms during a flight, there are procedures for dealing with this, including notifying air traffic control with details of the situation so that that particular passenger can be met on landing. In addition, effective March 18th at 12:01 a.m., in other words, a minute past midnight on Tuesday, all flights from Europe, Asia, Africa, and South America will be diverted to the Montreal, Toronto, Calgary, and Vancouver airports. Flights from the U.S., the Caribbean, and Mexico can continue to land at their scheduled Canadian destinations. By keeping resources focused in certain locations, we will ensure travelers are being managed as efficiently as possible. We're working closely with the airline industry and with airports to minimize disruptions and inconveniences as much as possible. Passengers who believe their travel plans may be affected should contact their airline for information about specific flights. Domestic flights between Canadian destinations are not affected by this change. I want to thank airlines and airports for their cooperation as we manage this ongoing situation, as well as to all flight crew personnel for their cooperation. These measures will carve out exemptions for certain essential workers who need to travel frequently into the United States. They will be exempted from the 14-day self-isolation. Examples of these people are the crew of any plane, train, or marine vessel crossing the border on a regular basis, truck drivers making deliveries across the border on a regular basis, persons whose profession requires cross-border travel, and finally, we will be considering other necessary essential workers as we move forward. Thank you.
Okay, merci beaucoup, Marc.
Thank you very much. And now, Minister Blair.
I'd like to begin my remarks today by acknowledging the many questions and concerns that have been expressed by Canadians about the activities that are taking place at our border in order to screen arriving passengers. I want to assure Canadians that from the outset, all of the actions that have been taken at our borders have been informed by the evidence and the expert advice of public health. Based on the advice of public health, on January 22nd, enhanced border measures were implemented at Vancouver, Montreal, and Toronto international airports, and then expanded to all airports on February 9th. These measures initially included asking travelers if they had visited Hubei province in China, and those who answered yes were subject to additional screening. Travelers who had flu-like symptoms were referred to the Public Health Agency of Canada. And as the situation evolved, additional measures were implemented. For those who had been to Hubei, they were required to fill out PHAC contact forms, Public Health Agency of Canada contact forms. They were given surgical masks. On March the 4th, on the advice of PHAC, we expanded the questioning to include travelers from Iran, and then on March 12th to include travelers from Italy. On March 6th, CBSA expanded all of the measures to include land, border, and rail points of entry. CBSA is responding to the announcement made by Dr. Tam yesterday. Dr. Tam, yesterday afternoon, strongly recommended that all international travelers should self-isolate. CBSA had been planning and was prepared to respond immediately to this direction from Public Health Agency Canada. And here's an example of what Canadians can now expect going forward as they're being processed from return from international travel. And as they pass through our passenger information kiosks, each of them, all of them, will be asked, do you currently have a cough, difficulty breathing, or feel you have a fever? They will be required to indicate on the form an answer to this question. They will also be asked to acknowledge that they are being asked to self-isolate for the next 14 days to prevent the potential spread of COVID-19. In addition to these measures, there will be enhanced officer presence at all major airports of entry to carry out public health screening and outreach. The officers will be on the lookout for any traveler who looks ill and may refer any suspected cases to public health authorities. In addition, all passengers will be given instructional handouts upon arriving in Canada, and the handout will advise them to self-isolate at home for 14 days, to monitor themselves for symptoms, information on those symptoms, and direction to contact public health authorities if they develop any illness. There will also be increased signage at all points of entry. The important measures that have been announced today, adding additional restrictions, will make the critical work of our border officers far more effective. And for example, by limiting international flights to our 4 main airports, it allows for the concentration and efficient use of our limited resources. As we will identify ill passengers before they arrive, they'll be met at the gate by border security officers, isolated from passenger processing areas, and referred immediately to public health officials. And finally, by significantly reducing the number of non-Canadian travelers, we will see a significant reduction in those traveling to Canada, and therefore a reduction in those who need to be processed. We recognize that this is a difficult and ongoing fluid situation. I want to thank all Canadians for their patience in this trying time. I also want to assure them, as our work proceeds forward, we will do what is necessary to keep Canadians safe, and we will ensure that all of our measures are measured and based upon the best scientific and expert advice provided by our public health authorities. We will continue to work with those authorities, all of our provincial and territorial counterparts, and our international partners to do what is best for Canadians.
Okay, thank you very much, Minister Blair. Maintenant, c'est à vous, ministre.
And now, Minister Duclos. Thank you very much, Minister Freeland. As co-chair of the committee, I would like to begin by thanking all of our colleagues for their extraordinary efforts over the last few weeks to meet the challenge of this extraordinary health crisis and security crisis and economic crisis. I would also like to thank our territorial and provincial partners and mayors who are working with us to make sure Canadians and Quebecers are safe at home. I would like to assure all Canadians that the Canadian government is doing everything that needs to be done to keep everyone safe over the next few weeks.
I will just say before we take your questions to remind everyone that Dr. Tam and Dr. New will be available to you to provide that expert public health advice as soon as you have finished dealing with us.
Okay, so we're going to take 5 questions from the floor, then we'll go to the phones. Reminder, we're using the microphone. We're going to go Joanna Smith from Canadian Press, and then Marie Vestel Le Devoir.
Hi, good afternoon. At those 4 airports, when people are being asked to self-isolate, are they going to be asked to self-isolate there, or are they free to go home?
No, what we're instructing them after they have been processed, and again, these are for people who are not symptomatic, but for all others who are coming in, they'll ask to go home and then begin the process of self-isolation. And with the documents and information that we'll give them advice on how that might be accomplished safely and healthily.
And what measures are you taking? I mean, presuming there's going to be much longer lineups now to go through processing. That's crowds of hundreds of people and gatherings much larger than governments are recommending people gather in. What measures are you taking to make sure that airports themselves don't become a vector for disease with these touchscreens, in particular the questionnaires?
Yeah, it's a very important question, and measures are, in fact, being put in place. First of all, as a direct result of the measures that have been taken limiting non-Canadian travelers coming in from international destinations, there will be significantly fewer people that have to be processed. But we are taking measures in the processing areas and in the hallways approaching them to ensure that proper social distancing is practiced there. There will be available CBSA officers, our border service officers, who will be there provided with masks for people who may be symptomatic and be able to take people out of those lines. And as we've also indicated, people who are symptomatic as they arrive will be met right at the gate and not put into those processing areas. I am also aware, and perhaps Mr. Garneau could mention, that other efforts are being made to make sure that the areas in which the arriving passengers are processed are regularly cleaned and disinfected to make sure that they are safe and healthy environments for this action to take place.
So perhaps Minister Blair covered it, but essentially we were in touch with the airports last night, and this is for all airports, with respect to trying to lay out things so that there is more social distancing when people arrive at the airport, whether they're on their way in or on their way out, and secondly also that increased levels of disinfection take place at the airports.
Okay, we're going to go Marie Vestel Le Devoir, and then Lina Deeb, La Presse Canadienne.
Hi, I don't know if this is for Mr. Haidu or Mr. Blair, mais Monsieur Garneau, si vous voulez répondre, vous pouvez répondre en français.
Mr. Garneau, feel free to respond in French.
You're wearing your earpieces. In regards to travelers from the U.S. who are still allowed to come in, they will not be directed to those strictly 4 airports where you're redirecting traffic. They will be going still to every airport. So are there any extra measures that are being put in place for those travelers, given that Ontario Public Health today said that they have snowbirds coming back from the United States who are contaminated, for lack of a better word in English? What are you doing to ensure that those people who you are still letting in don't just
spread out the virus even more?
If I may, all of those in those airports, because there are other international flights coming from the U.S. and other sun destinations that are coming in there, all of those returning travelers will be given exactly the same information. They'll have to fill out the same forms. They'll have to advise if they are symptomatic, and on the form they will also have to acknowledge that they have been advised to self-isolate. There are additional questions and observations that will be made in those airports by our officials. If anyone is symptomatic, there are processes in place to identify them and appropriate referrals to public health. And in every case, all of them will receive information to self-isolate. And that, by the way, is not just those snowbirds, as we often refer to them, people who currently are, maybe spent the winter down in Florida or in Arizona. Many of them will be driving back. That same information will be provided to them as they cross into Canada, ensuring that they understand the need to self-isolate for 14 days. That's the advice that's been given by Public Health Canada, and that's the advice that will be communicated to each and every one of them.
Alors, en français, tous les
So in French, all Americans entering Canada will be subject to a questionnaire asking them what their health is like, and secondly, asking them to confirm that they have been informed of the requirement to self-isolate for 14 days after they enter the country. They will have to indicate that they have received this information before they are allowed to leave the airport.
Okay.
Okay, and on that decision to only have other flights, not U.S., so to essentially close the border to any other countries except the U.S. and others, but about the U.S., the Prime Minister has sort of exposed his reasoning for not banning U.S. flights, saying the trade is too integrated. But how does that prevent you? You've been quoting scientific expert evidence. So what is that evidence that prevents you from banning visitors and tourists and still maintaining trade? Why can't you do one and not the other?
Let me take a crack at that on the Canada-U.S., and
Sure.
then I think our colleagues may all want to chip in. So when it comes to the Canada-U.S. border, I think it's very important to say that this is a situation which we are reviewing constantly, in real time, in very close collaboration with provinces and territories, with Canadian business, with unions, and very much with our public health authorities, and of course with our U.S. neighbors. The Prime Minister spoke with the President yesterday and was on a G7 leaders call this morning, and Minister Blair spoke with his colleague, his counterpart, the Secretary of Homeland Security. Canada and the United States have the longest unmilitarized border in the world, and that border, we all know, is absolutely vital to the daily life of people who live on both sides of that border. At the same time, I think both Canadians and Americans understand that we need to constantly be reviewing the practical measures that we can and need to take to protect the health and safety of Canadians and Americans. And that is something that we are constantly reviewing and we are working on. As Minister Garneau said, the strong recommendation to self-isolate for 14 days after coming into Canada from outside Canada also applies to people who are coming to Canada from the United States. We have understood, just because of the way that that Canada-U.S. border in particular is a lifeline for both of our countries, that there do need to be some carve-outs to that strong recommendation for essential workers. People like the truck drivers who are driving trucks of food in both directions across the border. People, as Minister Garneau said, like air crews. There are other categories of essential workers as well, and that is a situation which we are closely and continuously reviewing. Je peux me répéter en français? Non, ça va? OK, est-ce que quelqu'un...
The scientific reasoning behind not still allowing trade but banning visitors. Why can't you just do one and you have to keep both open?
If I may, both of our countries, Canada and the United States, have issued warnings against non-essential travel. And so I think that is very consistent with our approach that would significantly limit the people that you refer to as tourists and others and visitors. And so, but it is an acknowledgement of essential travel, and we also recognize that in these circumstances, at this point in time, that we believe that the risk of those essential workers crossing that border can be managed effectively with the screening that we've put in place and with the instructions and oversight of Public Health Canada for isolation measures where required. And so I think it is important to acknowledge that we recognize that our country's the critical infrastructure and our economies are significantly integrated, and additionally that there are Canadians on both sides, Canadians and Americans on both sides of that border who need, for purposes of their employment and to help keep Canada running properly, to be able to move across that border. But we will put the appropriate measures in to mitigate the risk that may represent to Canadians.
Minister Hajdu, I don't know if you want to add anything.
Just, I think my colleagues have summarized it well. I mean, what's called for is really a continental response, as we know, with an integration of supply chains, and in this case, critical supply chains that include food and essential goods that Canadians rely on every day. What we do on the American border is going to have to be done thoughtfully and in partnership with our American cousins, as well as our Mexican partners. And so this week, I have a scheduled call with Secretary Azar and my Mexican health counterpart to talk about a North American approach. Obviously, there are challenges in this situation that are unprecedented, but I know that Secretary and Azar both believe that we have to be cautious and prudent in how we apply this so that it doesn't pose other health risks to Canadians and Americans that would include running out of essential goods.
Okay, we're going to go to Lena Deeb and then Ashley Burke.
Yeah, maybe I'll try you again on the same topic, Minister Hajdu. Just talking about health and science and not taking into account the goods. I'm still not clear on why are we still letting Americans come into Canada? We're not talking about truck drivers. I mean, they can get specific permits to drive food trucks. Why are we not shutting the border to all Americans when we see what's going on in the States on the health picture of things?
Well, again, we've advised all Canadians to avoid non-essential travel. Our counterparts are in the process of doing the same kinds of measures around the world. I will say that making sure that we get the right specific details about what are essential workers is critically important. That's work that's happening right now, I know, with Minister Freeland and others around making sure that the policies we put into place together is not going to have an adverse impact on the functioning of either of our countries. Listen, you heard my opening remarks. Canadians are worried about their food supply. This is a real thing and a live thing in North America where we have an integrated economy, integrated supply chains, and where both countries rely on each other to provide essential goods that include foods and other products for our homes, etc., including medications. So it's very important that we do this with a degree of precision and in the spirit of a strong relationship that much of the work that we've done in previous on things like NAFTA has been conducted, and that's the work that we're doing right now. We'll have more to say in the days to come.
Ms. Freeland, when you spoke with the Americans about the possibility of closing the border, did their reaction lead you to make the decision you have made and not a more rigid and quicker decision? Was it the reaction of the Americans which inspired your decision? Answer, no, absolutely not. Our decision is one which was taken by Canadian leaders alongside the Prime Minister. We had a cabinet discussion involving all cabinet members when this decision was taken. The decision was taken to protect the health and safety of Canadians. And for us, for our government, the health and safety of Canadians will always be our top priority. Canada is a sovereign nation. Our decisions are taken by Canadian leaders for Canadian citizens, always.
CBC, and then we're going to take some from the phone.
Minister Hajdu, there's been a lot of talk about that the window is narrow to flatten the curve. How narrow is that window? And as well, does the data suggest that Canada right now is flattening the curve?
Well, thanks. Those are really good questions. And the window is narrow because now we will see an acceleration of cases. We now have community transmission in a number of locations across Canada. And what that simply means is that we cannot actually pin a case to international travel, that we are seeing it spread from community member to community member. And so we are at a critical phase, as Dr. Tam said, because the intent now is to contain the cases as rapidly as possible and to slow that spread. In terms of, so that's how narrow the window. Could you repeat the second question, please?
Does that suggest that Canada's flattening the curve right now?
So it's too early to tell. The answer about the curve and whether or not we're flattening the curve, it's too early to tell. What I can say is that the evidence so far suggests that our early measures have been successful in actually being able to pinpoint where cases are and to not have the widespread transmission that we've seen in other countries that have taken either unorthodox measures or not taken any measures at all. For example, we knew we had cases before we had deaths. In some countries, they knew they had deaths before they knew they had cases. And that is a very bad sign. What that means is you have uncontained transmission and people who have been sick for a long time before they die, allowing for further spread. In our case, because we have had a steady progression of measures based on science and evidence, we've been able so far to be able to contain our spread. But now as we see our cases grow through community transmission, this, as Dr. Tam said, is the critical phase. This is why we're calling on all Canadians to take these extreme social measures, including staying home, including working from home, including the cancellation of events. Later, Dr. Tam will make an announcement that we're now asking people to consider canceling events that are larger in size than 50 people, because the time is so critical. And so I would urge all Canadians to do what you can to be part of flattening the curve.
There are a lot of Canadians right now that are abroad trying to get home. They're trying to follow the government's advice and book flights. Some of them have to wait days, and there's a fear out there that they're going to be stuck in another country. That country's border could close down. And as Minister Champagne's been saying, there won't be repatriating Canadians from around the world. Are you talking to airlines to try to make sure they're still flying, getting extra flights there? What is being done to make sure Canadians are not stuck abroad?
Thank you. So we are conscious of the fact that some people Canadians are abroad and are having difficulty returning and will have greater difficulty as a result of the measures that we have announced today. So we are talking with the airlines. But in addition, about the possibilities to bring people home, it's the very early stages at this point. But also, I would say that we are also putting in measures, funded additional consular support and partnerships with on the medical side, so that if there are Canadians that are abroad that could not come home because they were symptomatic and have to attend to their medical needs, that there will be some assistance there from the consular point of view and financial assistance, and that if they have to stay outside the country for a period of time unplanned because they wanted to come home, that there will be a fund to provide some financial assistance to those Canadians.
Okay. We're going to take one more from the floor, and then we're going to go to Marika Walsh for the Globe and Mail.
Hi there. I'd like to get some more information about what the coordination is between the provinces and the federal government. Canadians across the country are getting very different information. I understand different jurisdictions. I understand different caseloads and all of those things. But the Prime Minister said today there is an aligned response, and we're not seeing it. So why isn't Ottawa giving a baseline minimum response that everybody needs to take, and then provinces can increase measures where it's necessary, for example?
Okay, I'm going to maybe ask Minister Hajdu to talk about the very close coordination that is happening on the public health side, and then maybe I'll make a couple comments about cooperation with provinces in general.
Well, thank you for the question, and I will say that that's exactly what's been happening since the very early days when we first noticed that cluster of cases in Wuhan. Dr. Tam convened what's called the special committee that pulls together public health officers from all across the provinces and territories with the federal government to begin that close coordination to prepare for what could and what did eventually become a pandemic. So that coordination is happening, and there are baseline guidance provisions at all different levels, at technical guiding levels for hospitals and for practitioners, a variety of other kind of considerations, including procurement professionals that are working across jurisdictions to make sure we have a scope of the knowledge about what's needed, where the gaps are. That work has been going on since very early January. Of course, we have also provincial and federal jurisdictions in terms of the types of measures that we can take and our own distinct responsibilities. And so the work that Dr. Tam is doing is to try to coordinate a response, but also to recognize that provinces and territories have the jurisdiction to act in a number of ways that is independent of the federal government.
And if I could just add that, we very much recognize, as Minister Hajdu has just said, that there are specific conditions in specific cities, specific provinces. That's why we have public health officers also at the provincial and the city level. And those public health officers are all behaving in, I would say, a very admirable, proactive, and energetic fashion. As Minister Hajdu said, there is very good national coordination of all of the public health officers. And at the political level, on Friday, we had a call chaired by the Prime Minister of all of the First Ministers. Since then, over the weekend, I spoke with a bunch of premiers directly. So did the Prime Minister. We plan to now have regular calls at the First Minister's level to coordinate our national response. That's going to be very important. And then just finally, it is so important, given that this is first and foremost a question of protecting the health and safety of Canadians, to be very clear with all Canadians that the federal government absolutely acknowledges the need for federal leadership. We are not going to quibble about federal provincial responsibilities here. The federal government will be there to be sure the Canadian healthcare system across the country has the resources to deal with this situation, whether it comes to our national bulk procurement efforts or the commitment that we have made to provide financial support to the healthcare system.
Okay. Operator, take a question from the line.
Thank you. Once again, please press star 1 on the telephone keypad if you have a question. N'hésitez pas à appuyer sur étoile 1 pour toute question. The first question, la première question is from Hélène Buzetti from Le Devoir, Hélène Buzetti du Devoir. Please go ahead. Your line is open. À vous la parole.
Oui, bonjour. Ma première question pour Monsieur Garneau.
Thank you. My first question is for Mr. Garneau. You acknowledged today that by limiting foreign flights, there will be fewer flights than previously. This will make it harder for Canadians who want to come home. So can you repeat whether Canada is willing to repatriate its citizens abroad? If they have trouble finding a flight, what kind of financial aid will you give these Canadians? Will there be a cap of $5,000, for instance? Well, as it now stands, we have not excluded various options, but we have begun discussions with airlines to see whether we could bring about a plan to repatriate certain Canadians who just cannot come home, or because there might be a delay for them, or because they might be presenting symptoms of COVID-19. So we're looking at all of those scenarios right now, and we're just at the beginning of that process in our discussions with the airlines. However, at the same time, we are recognizing that there will be a need for enhanced consular services. So we are going to send more financing to our consulates, and we recognize that some people will have to stay abroad for longer because they are either getting over COVID-19 or they are in the 14-day isolation period. So we would help these Canadians with financial support. We have not set a threshold, but we have set up a fund, and we will have more information in the coming days. My other question is for Ms. Freeland. You said that only Canadian citizens and permanent residents can come home again, and perhaps a few others. But there's a question for people who have a work permit or a study permit, study visa or work visa, people who don't have a status in Canada but who live here and who may have just gone abroad on a short trip. Will they be able to come back to Canada? People who have the right to return to Canada are Canadian citizens, permanent residents, direct family members of these two groups, and we will make some exceptions for essential personnel. Minister Garneau has already referred to pilots and flight crew. I'm sorry, I'm talking about people who have a worker student visa. So people who would also be included in that group are people performing essential services, including diplomats. What about study visas, people who have study visas? Well, exceptions are for people who are carrying out essential duties. This could include essential studies.
Yes, la prochaine question. The next question is from Manon
The next question is from Manon Cornelier of Le Devoir. My first question, or rather, I don't think you clearly answered my colleague's question on work and study visas. If you could clarify that for me, that would be good. I do not understand why there's talk of avoiding food and medication shortages, and this is the reason why Americans will still be allowed to enter Canada. Why can we not state that American tourists will not be allowed into the country while keeping our supply lines open, and this would not prevent essential workers from crossing the border? So why will American tourists still be able to enter Canada? Now, with regard to our border with the United States, a few things. First, we have already stated, as Minister Blair pointed out, that persons coming into Canada from abroad, including from the United States, will have to self-isolate for 14 days. This is a strong measure. This is a measure which applies to everyone, whether they are Canadian or American, whether they are crossing a land border or flying in. That is a significant measure. Second, as Minister Hajdu said, and as Dr. Tam said over the weekend, it is recommended that all Canadians not to engage in non-essential travel abroad. This is also a strong measure. With regard to other potential measures at the border, well, I believe that all Canadians understand that we share a very special border with the United States. It is our only land border, and it is an essential border for the economic life and for the social life, as Minister Hajdu said, for Canadians, and for the supply of food in Canada. So all we are doing along our shared border with the United States must be very specific. We are taking very specific, detailed measures, and we are working with business leaders, with unions, with the provinces, and with our American partners. So we are doing that work, and this is a situation which we are monitoring closely hour by hour to see if there are any changes, but I believe that Canadians understand that with regard to this border, we must take measures, or rather, we must make sure that anything we do will not create problems in our country, including health problems. Perhaps Minister Duclos would like to add a few words. You have well summarized the situation, Minister Freeland. That said, I would simply like to point out that over the last few days, the situation has been evolving very quickly with regard to airlines and the border. Just a few days ago, Canadians were invited to avoid all non-essential travel abroad. On Saturday, Minister Champagne invited Canadians to quickly come home again, given that the availability of commercial air flights was shrinking. And yet yesterday, it was clearly stated that all travelers entering Canada, be they Canadian or foreign nationals, would have to self-isolate for 14 days. And this led Minister Blair to implement measures in all airports. As he indicated earlier, he has added an additional question for returning travelers. They must acknowledge that they realize they must self-isolate for 14 days. So any traveler coming in through an airport, anywhere in particular at Dorval since last evening, must indicate that they have clearly understood their obligation to self-isolate for 14 days. I say this because Mr. Garneau and myself have spoken with Ms. Plante, the mayor of Montreal, over the last few hours. We have told her of this situation, this measure, which we brought about yesterday. She was very happy at that decision, and I think things are much clearer for everyone now. Mr. Garneau would like to add a few words. With regard to the issues raised by Ms. Buzetzi and Cornelier, with regard to persons here on student visas, in our approach, we have focused on essential workers, but you have raised an important issue, and we will come back to you on that issue.
Okay, I'm told, unfortunately, that brings our news conference to an end. Apologies to those on the list who did not.
À quel point vous êtes inquiet en ce moment?
The question was inaudible.
Respond to that.
Well, I'll speak from the health minister's perspective. I've been working very closely with Minister Dix in BC to talk about an approach that actually reaches our goal of obviously reducing cases and infection in Canada, while also, as I mentioned earlier, maintaining our supply chain. And I know that Minister Freeland has been engaging with Premier Horgan as well on the very same issue. As I said earlier, this is a complicated situation. Obviously, we are working very closely with the United States on ways that we can protect our citizens on both sides of the border, but that also keeps the integrity of our supply chain intact. Obviously, for BC, it is important that they have access to the U.S. market for a number of essential goods, including food, and the same can be said for the United States for many of the things that Canada produces. So we're going to continue those conversations with the Americans this week, and we will have more to say in the days to come. Thank you.
Yeah, in fact, I'd like to add on BC, if I may. Hang on. If I could just add on BC, as Minister Hajdu said, we are in very close contact with the BC authorities. Minister Hajdu is working very closely with Minister Dix. I spoke at length with Premier Horgan over the weekend, working with Minister Garneau. We made some changes, for example, to the treatment of passengers on BC ferries to help with social distancing. We are very aware of the situation in BC, where they are facing a significant outbreak situation. They are next door to Washington State. Premier Horgan has a very good relationship with the governor of Washington State, and they are also in constant contact. At the same time, as Minister Hajdu said, BC, like every single province and territory in Canada has extremely close, extremely dense social and economic connections, human connections with the United States. We need to, in taking actions on that border, act with real care, with real delicacy, and with real precision. The fact that we are saying to all visitors to Canada and all returning Canadians that they are strongly recommended to go into 14-day self-isolation means, self-isolation for 14 days in Canada, that I don't consider to be something that a tourist would like to do for a holiday. This is serious for everyone traveling to our country, and we are advising Canadians only to undertake essential travel outside the country. We are very carefully reviewing the situation at our shared border with the United States in close collaboration with our American partners. We are saying to Canadians, let's take measures here to protect ourselves and protect our neighbors. That applies to the people who live next door to us, and the Americans live next door to us. So we are working closely on this, but I want to emphasize to Canadians, and I think Canadians understand this very well, it is a dense and close relationship, and measures that we take there will be carefully thought through. It is important for us to be mindful of the really close connections. For example, as Minister Hajdu has said, food supply in Canada is very closely connected with the U.S. economy, and the U.S. food supply is connected with greenhouses across Canada. So we need to act with great care and deliberation, and we will also act with alacrity.
Okay.
Merci. On sera ici demain.
We will see you again tomorrow.